Hello, everyone. Welcome to the Friendly Circle Berlin. Today, we have a panel discussion titled ADHD Meds and You, offering clarity, knowledge, and practical tools for your ADHD journey. In this session, three well-rounded voices come together to offer clear, practical guidance on ADHD medication. Dr. Gia Whitecross is a consultant psychiatrist bringing an evidence-based overview of how ADHD meds work and what to expect. Tanzil Parkar is a clinical pharmacist offering down-to-earth insight on titration, dosing, and day-to-day management. And then we have Nick Pairaudeau, who put this panel together. Thank you, Nick. Nick is the founder of the ADHD Action Network, and he shares a lived experience perspective, what this journey actually feels like, and how to make informed choices without stigma. And together, they create a grounded, supportive space to explore your options and ask questions with confidence. One quick disclaimer: this session is for general educational purposes only and is not a substitute for personal medical advice. So, thank you, Nick. Thanks for all you do, shedding light on this really important topic. I'll turn it over to you now. Thank you.
All right. Can you hear me?
I can.
Thanks, Pat, for the intro. And yeah, I just want to thank my co speakers tonight. And yeah, just to give everyone some background, we are London based, so we're in the UK, the three of us. So it might be different for those in the US. We have a different healthcare system, as I'm sure you're aware of. We've got slightly different meds. I mean, they're the same meds, but under different branded names. And the UK's got a different, more of a social approach to healthcare than the US does with its private healthcare model. So there will be some differences, but at the end of the day, most of these meds are all the same internationally. I think I will leave that to the two professionals who will fill you in on that part. But just a little bit of background on me before we move on to the other people. I am, geez, what am I, 54 now? And I was late diagnosed with ADHD, so 2 years ago. And I stopped drinking 2 years before, and my mind hadn't stopped moving, which it had always sort of done that. And I got the diagnosis, and I think most people, that I've spoken to, because we run these peer-to-peer groups. We've run about six of them with about 87 people, coming through our in-person groups. Most people seem to want to get diagnosed so they can get their hands on the pills. So I think this is a very important discussion because, if you look online and whatnot, you find that many people sort of wax poetically that the meds are a huge game changer, and they are for many, but not for everybody. And my experience was, maybe not so, wonderful at the end of the day. Like, I'm not anti-meds or pro-meds. I think they work for some people and other people they don't work for. But I do think this is really interesting, especially in the context of addiction. Especially in the US where you see the issues with around Adderall, over prescribed to folks. And I just think that we're very lucky to be able to speak with two folks who are in the business of a doctor who deals with ADHD people, and a pharmacist who obviously deals with the meds. One final bit on me. My father's also a doctor. He has never been into meds. He's the only person I know goes to the dentist and will not take even any shots in his mouth. I've never seen him take a pill. He does not believe that the juice is worth the squeeze with meds. My mother is a mental health nurse, and she was pushing pills on us since we were a baby. So I come from these two extreme sort of folks, and I was kind of always middle of the road until I got older and had my own sort of mental health issues and took some of the meds, and they some worked and some didn't. So I think it's a really important discussion to have around these things. So I'll let Tanzil introduce himself, and we'll move ahead.
Cheers, Nick. So it's going to be a bit of a short introduction, really. So my name is Tanzil. I'm a clinical pharmacist in the UK. I've had a bit of a weird experience in the sense that I've worked across different settings, be it retail pharmacy, like what you see on the street in supermarkets, as well as in hospital, general practice, so family physician offices. And I've even done some work for the British version of the CDC, which is known as UK Health Security Agency in the past. And yeah, currently I'm working in private care as a clinical pharmacist, but I'm also working with health tech startups trying to help improve, like, try and make healthcare more accessible to everyone. And I think that's me in a nutshell.
Thank you. I, yeah, you like to introduce yourself?
Hi, I'm Gia Whitecross. I'm a consultant psychiatrist and I work in the NHS, which is our National Health Service, and privately as well. And I've also got ADHD. And I think it's I think the medication can be transformative. I think the trouble is that most people prescribing don't have ADHD. So and we'll talk about that there's this sense that you should take your medication every day. And I talk a lot with my patients about mind health optimization and sort of self-awareness and understanding of when and why you're using your medication. And it's part of this incredible toolkit that you can use and that anyone could use in terms of they can't use the medication, but they could use things like meditation and cold pool plunging and other things to improve focus. So I really do present it like that. And I'm very much of, just I've just finished clinic and I'm really about empowering people to have like ownership over how they take their medication. That's me.
Yeah, thank you.
And the only other thing I just want to say is I'm going to reopen Zoom, so I may go and come back in.
All right, perfect. I'm just going to frame sort of the main sort of issues right now quickly, and then we'll move on to you about myths and realities. So I, as I said earlier, I think one of the main reasons people do get diagnosed is because they're very curious about the meds. And that was the reason I got diagnosed. I wanted to try the meds as well. And with medications, a lot of the time, they're a quick solution to a very complicated problem. And in most, and that obviously all of our brains are different, all of our lived experiences are different. And, it makes the meds very, very complicated. And then I think we're also barraged with so much social media. Um, and the other thing too is the medical system is incredibly overwhelmed. Many of the doctors simply don't have the time to spend with their patients. Even an assessment happens relatively quickly because you're supposed to share with the doctor your entire sort of life history, and they might get to spend a couple hours with you, someone who's never met you before, assess you, and then put you on the meds. And you sort of leave there with your diagnosis, let's say, and then you're left with the meds, and then it's sort of like, okay, what next? And I think it's a situation that most people are left with. Um, and that can be pretty overwhelming because once you get the assessment, you think like, oh, this is the holy grail. I've hit the top of the mountain, when you've really just hit the base camp, really, of your whole journey. And as Gia said, it's the pills are simply a part of the toolkit. So in the UK here, they have something called the NICE guidelines, which are the government's guidelines, and the psychoeducation is supposed to come before the meds. But in most cases, there aren't the resources for people to learn about this other than possibly online. And it's very difficult. And Tanza will talk about health literacy and the issues with a lot of the information we're getting via, TikTok or, whatever social media platform. Usually it's short clips. Who knows who most of these people are? And who knows what kind of information and quality information we're getting. So we really do, all three of us believe that education that's why we're here tonight, is critical. And education around the meds in particular are something that seems to be, I spent some time this evening before we came on the call looking for some really good quality YouTube videos, and it was not easy. There was a lot of dry stuff by academics, or then you get the really short, punchy stuff done with TikTokers, and there seems to be nothing in between. So, hopefully tonight, people who work in the business, at the end of the day, I think all of our journeys are our own, and everyone's got different experiences. Mine with the meds was not necessarily so great. I was very lucky to live with someone that whilst I was taking them, she could, see how my personality changed. And she knew exactly the day I started the meds without even knowing I had started taking them. And I had started becoming quite sort of aggressive, incredibly focused. And when we sat down and looked at the work I had accomplished, I wasn't really getting any more done. I was in my mind thinking I was getting more done, but I wasn't necessarily getting more done. And there were some side effects we'll get into later. But really, my experience was, very mixed. And, that's just my story. But it's interesting. I run these groups, and in most cases, side effects are a big issue. And they're not, it seems like people talk about these things privately, but online you don't really hear so much about the cons. It's mostly just pros, 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 pros. So, there's I just want people to know there are different perspectives, and yeah, that's basically in a nutshell. I think this is the position we're in. And in the US, it's actually, it's really quite interesting, because I know that Adderall, there's a major issue with overprescribing of Adderall, and a lot of students, especially in universities, use them very heavily. Even folks who don't have as a study drug, and then they go into work and they continue using them. And there's also a lot of really interesting history with the military taking them in the Second World War, where there was a lot of use on both sides, the Allies and the Axis taking these meds as well, and some really interesting research on that as well. But I'm going to hand it over to the pros now. And Gia was going to really cover, I think, myths and realities of the meds. And I think it's a great place to start. She's got a little presentation that she can share with us now. Thank you.
So I'm just going to try and share my screen. And while I'm trying to do that, I'm going to say that I am not the pro. I always say that you are the professional. Like, you know yourself better than anyone else. And we can guide and say based on the evidence, based on my experience, but you know yourself. And I would really empower you to sort of take that ownership over your own mind health. And the other thing, while I'm trying to work out the host tools, is that I think it's a superpower. I hate the word disorder, but like any superpower, you have to know your kryptonite, and it's harder, I think, because we've got so much overstimulation now. And I wonder what I would be like if I'd grown up with a phone. Would I have ever read a book? Probably not. Would I have been distractible? Yes. So it's a harder time. But let's see if I can actually share my screen. I know that actually the things that widen your window of tolerance when you are more thoughtful between the trigger and response is the medication. If you are on too much medication, imagine someone taking loads of steroids, they become irritable. That's the side effect. So what Nick experienced, some people in my group were discussing, that's what it is. You are on too much medication. And today I saw someone who's
10 milligrams, though. Yeah, I was on a very low dosage.
Oh, really? So, well, maybe you're sensitive and maybe that medication isn't right for you. And maybe you are on a short acting, because short
Yes,
acting
it
in the,
was short
yeah.
acting. Yeah.
The thing about short acting medication is it makes you irritable in the beginning because you're going to get agitated. And the thought process is that as it gets released, you'll start to get used to it and your heart rate goes down. But a lot of people, for most people, they don't actually like the short acting that much because it is that sort of agitation, irritability. But that's why I in general prefer the long acting. It's more like you're going to switch on, but your car's going to switch on slower and it's more like this rather than a really sharp one. So I don't think anyone I have treated has experienced a change of personality. But the only difference is that you have glasses on, but the glasses are not always the best glasses. So if you're trying to do something quite neurotypical, pay your bills, pay your parking fines, write an essay, that is really, really helpful. But like for example, I was trying to come up for like a name with my business, and that's where the ADHD sort of superpower comes in. Because a name for a business, I need to like bounce in my mind from thing to thing, and I just couldn't think of anything because I'd taken medication that day. But the next day, it just came to me. It was just so easy. I could riff on my own brain.
So
So
more
it's
creative off the meds
yeah,
than on.
yeah.
Interesting.
And it's similar with artists that I treat. I'm telling, we think about it. Like if you're doing your admin or you're like picking up your three kids from different places, the medication is helpful. If you're like in a creative space, it's not always helpful. So I don't think it changes anyone's personality. And the main thing to say is that you know, even the long acting, its half-life, so when it becomes half of the amount in your blood, is about 12 hours. So it's not going to last very long either. Um, the next one is that you should take it for life, or you should take it every day. And again, I saw Tanzil shaking his head. It's like, you don't need to take it for life. A lot of periods of my life, I haven't taken medication, and I really don't like it when, and that's another thing that's come up in our group, is that other doctors have told them you need to take this every day. No, you need to learn how to optimize your mind health. But what you can't do is like have a big break, say you've stopped for a week, and then go up to like a bigger dose. You have to think your body's like, let go of that, got used to it. So you can't go straight up to like 30 milligrams even. I would go back down if you're taking Elvance or lisdexamfetamine. I'd go back down to a baseline again because your body's got to get used to it. I'm actually very into microdosing and like taking too small amounts of long acting because then you get a lovely, you're not going up and down. You've got a lovely thing and you're avoiding the crash. I I really work with people to think about what days do you need it? When does it optimize you? When does it promote your mind health? I really I struggle a lot with GPs because in the UK, so the GP carries on the prescribing and they might say, oh, well, someone hasn't picked it up for 2 months. It's like, no, because they're using it when they need it. They don't need to take it every day. This is another one. You can't take ADHD medication with recreational drugs. Look, it's not a good idea. I don't think it's a good idea to drink alcohol and take it. You might feel terrible. And that's why I say to people is like, if you're going to drink, I would advise that day you don't take the medication. Or if you do take the medication, take it as early as you can in the morning. But it's the combination of taking like cocaine, like another stimulant, MDMA, because we already know that, especially the stimulant medication, is increasing your blood pressure a little bit, it's increasing your pulse a little bit. So the idea of taking that with something else that's going to do that is you might end up feeling horrible. So I never say to people like, don't do it, but just be aware that its impact on your body could be quite horrible. And so it's not a good idea, it's not advisable. The reality is that a lot of people with ADHD suffer with addiction to alcohol, might be chocolate, might be TV, could be pornography. But actually, what we know is the medication actually helps. So I've got patients who've been on, using serious substances like crack cocaine. And actually, when they're on the ADHD medication, they've actually found that they can slowly cut down what they're using. Um, let's move
Got a bit of
along.
a quick question,
Yeah, go
actually.
for it.
So in the UK, it's actually seen as a bit of a criminal offense to drive with amphetamine in your system, which if you're taking Elvance or dexamphetamine, there is a likelihood to do so. So if someone was to, say, for example, drive whilst taking ADHD meds, how long would you advise them to wait before they can start
Oh
driving?
no, you can drive with ADHD medication. ADHD medication isn't continued to, because it's not an illicit substance. You only have to let the DVLA, the driving people, know if you think it impacts your driving. So you don't, so yeah, it's absolutely fine, and you don't need to tell. Like most people don't tell the DVLA because actually, most people I find with ADHD actually hyper focus when they drive because they're like locked in. And if they are someone who thinks it impacts their driving, then they do need to tell someone. But other than that, it's fine.
Awesome.
Um, the other thing is about sexual dysfunction. And I mean, what's interesting is that there's no like research which has shown that. So unlike medication like antidepressants, like I don't know, SSRIs, serotonin reuptake inhibitors, which are the most common ones, they do cause sexual dysfunction in some people, and that's supported in the research. Like they might have delayed orgasm, they may actually have a loss of libido, and it's hard to unpick, is it the depression or the anxiety or is it the medication? But often we think it's the medication as well. But this hasn't shown that. For some people, people who've like been told to concentrate because they start talking while they're doing other things, it's actually helpful to feel more like, sort of streamlined in your thoughts. I've actually never seen anyone say that they've suffered reduced libido or any sexual dysfunction. Again, if that is happening, I would encourage you to think about the medication and go back to it. And is there an alternative? But I haven't seen it.
Well, you've
Um,
got one person here that had issue with that. So then there you've got your first person.
and you were on a
I actually
short
know two
acting.
patients as well who have been on
Yeah, I
methylphenidate
like
who've had
my
And is
issues.
this libido or is this sexual dysfunction, as in like unable to orgasm, or what's the?
no, I mean it was both libido and then there was how would I put this in a clinical way? Maybe there was no lead in the pencil. Let's put it
Oh.
that way. It would be very similar to using too much cocaine. You might get the um how would one say it?
But
Limp dick.
lots of people use
Like,
cocaine to have sex. I mean, it's sort of chem sex.
well, no, excessive cocaine affects most people's ability to get erection. At least the friends that I've known and talked to about that. Maybe, I mean, uh, yeah, I just think that a lot of these stimulants do affect the peckerwood. Let's just leave it as that in a humorous way. But yeah, I also had that same issue though when I was on an antidepressant, where the
I
libido
think
was.
you're sensitive, and we should think about a long acting and just a trial, being curious
Yeah,
about it.
but I certainly would. You could add me as your first person that you've
You're
known.
my case report.
There you go. And Tanzil knows too as well. So
We've
Yeah,
talked
in
about
their case, it was like
yeah.
essentially just loss of libido for the patients, which I encountered. Although one of them was actually happy about the prolonged, I mean, delayed orgasm. They were actually quite happy about that because they themselves,
Mm.
prior to taking methylphenidate, was actually suffering from premature ejaculation. So for them, it was actually a benefit.
There's a helpful side effect.
yeah, and
Um,
it did worry me if it was doing that for down there. What the hell is it doing to my brain? I had to ask that question. You know what I
You
mean?
remember it's like the half-life. If you're taking a short acting, it's like 4 hours. So the
Yeah.
amount when it becomes half the amount in your blood is just 4 hours. And then for your brain, it's the same. It's 4 hours, like 12 hours if it's a long acting. So actually the next day, you're the same. If it's a short acting in the afternoon, you're back to your brain chemistry is just like whoosh. It's
Yeah, these flush out of your system quite quickly,
yeah,
don't
so it's not, I mean, that's why I think people should be curious and like, I don't know, I think they can be hugely effective, but it has to be, you really have to work alongside someone to really help them kind of begin and also to microdose. That's the other thing. And because the only other thing I would say about titration is, people want to go up quickly on the stimulants. And the person I trained under was like 20 milligrams, which is the lowest dose of the long-acting lisdexamfetamine, the stimulant, for 1 month. She said that people underestimate how much they get done. And she was completely right. Like, actually, in an ideal world, like a very small dose for a month and see. And then you'll be like, because people want to go higher and higher, and that's when they become irritable or they're on the wrong dose.
addicts
But yeah,
especially want to take more because if it's working, an extra one's only going to make it better, isn't it?
no, well, this is it. I know it's true to form. But shall I hand over to you? Because Tanzil, did you want to talk about side effects?
Yes, but before that, I actually wanted to just ask something which some of the audience may not be aware of. So with methylphenidate, like as me and you know, there's actually quite a lot of different preparations, not just in the UK, but US as well. But also, like with the long-acting ones, the dosing regime can vary from one to another. So, say if somebody was, say, for example, taking Concerta, but they wanted to try Aquasim or Mediconnect, like what advice would you give to them if they were curious about other
Yeah.
like
So if anyone like
methylphenidate?
doesn't know about these, there are these kind of, so we have like typically we had like short acting, like in your body, out your body peaks, it's like 4 hours-ish tops. Then there's the long acting, like 12 hours. But now there's new ones where you can have like 30% released immediately and 70% released afterwards. So like as in, so you've got like a proponent which is short acting, so it gets you going. So you're not going to have to wait like an hour and a half to get going. And there's the 70% gets released slower. So it's actually quite nice. I think it's about like if you can work with someone who can try, like, okay, let's try this preparation and then let's try that preparation. I actually, I'm very lucky that I've got a very good psychiatrist myself, and I can say, like, oh, for example, I wanted to try Equisim, and I was like, can I try this for a period, to see how different it could be. Um, I wanted to see because with the long acting, it takes longer to switch on, and how, but I don't like short acting, like Nick's, the short acting ones. It gives me a headache, I feel agitated, and like my heart races. So I wanted to try one which was a combination. But I found that I actually just got a headache, which has always been this case with methylphenidate based medication for me. Um, what I really encourage people to do is like think, why are they changing? What is the purpose of this? And then it look, most medications, if you looked at the back of like paracetamol or ibuprofen, like it has a lot of side effects. So even the big thing that people don't realize is the cumulative risk of taking an amphetamine. Because most people, when they talk about ADHD medication, they are talking about the Ritalin style medication. And it is putting up your blood pressure slightly and it is putting up your pulse slightly. But what what they say is that like cumulatively you're not more likely to have cardiac events over a lifetime, right? So they don't think that, and they think actually because people with ADHD are more likely to have accidents and things like that, you're actually, you're less likely to die basically if you take medication properly or appropriately for you. um I, I'm really surprised by the variability in people's response. So, I like the 2020 of lisdexamfetamine, which is like Elvance in this country. It works for a lot of people, but what I'm surprised by is that like some people like 30/20, some people actually like 30/30, some people just like 20, and some people like methylphenidate, which is Ritalin, the short acting, they love 5/5. And it's not about weight or height or like race. Like I can't see the only thing I've seen in terms of patterns is what do your family take? And I do the same with antidepressants. I'm like, if your mother or father has depression or anxiety or your sister, what did they take? What didn't work for them? What did? Why did they feel this? And I do a lot of family history stuff because actually, and it's the same with the ADHD medication. If it's worked for your sibling, that's the only thing I've noticed is that that combination is likely to work for you. And that's it, really.
Yep, I think that leads to another question of access to care. So I went privately when I did my assessment. So and probably like I mean the US is probably more expensive to see a psychiatrist privately. And then you're left with then you've got so the psychiatrist or whoever does the assessment, and then you get whatever you're given, and then you're sort of left in the hands of your GP, and there is a break between communication and the GP a lot of the time, at least in this country, doesn't know much about ADHD and also does not want to get involved in the titration and the management of the drugs, and it leaves a lot of people out in the cold. I mean, that they'll spend a lot of money on an assessment diagnosis, and then their GP's like, well, I don't really want to manage this. And I think there's a real crisis around that. Getting
Absolutely.
these meds right, like you might want to try a bunch of them, but that takes time, money, and in a lot of cases we don't have either of those. So any suggestions around that?
Like so the shared care. So I don't know how many people are from the UK, how many are from America, but in the UK, we've got such huge waiting lists for ADHD. There's lots of people tend to go privately to have their assessment and get titrated up onto the medication. And I think a lot of people want to whiz through the titration and then get back to the GP because when you're doing it privately, it's expensive, right? And this is when the titration is really important because when the GP takes over, so we've got this thing called shared care. You demonstrate that after 12 weeks of being on the right dose, you're doing really well. Your like your physical health, your like weight, your blood pressure, your pulse, everything's good, and you send it back to the GP. And then your psychiatrist should see you anywhere between 6 months to a year to think through. But the thing to take note is that your GP is just taking care of your physical health and the prescribing, but they cannot change the dose of the medication. So the big thing is not to rush out and get to the GP because if you need a review, the GP can't change that. Um, Most GPs in this country do accept shared care, but recently in Scotland they've just said no to me. So it's interesting. So it's not like there is some variability. Um, I think it is important to see a psychiatrist if you're on this medication at least every 6 months to a year, just to have that time and space to think through, like not just about the medication, but how's your lifestyle, like pornography addiction, sex addiction, like alcohol, it's thinking through all that and then thinking through kind of lifestyle interventions, meditation, exercise, hydration. It's just to have that space and time to think about it. It's a hugely frustrating place to be in the UK at the moment because the waiting lists are so huge. And actually, it wasn't like this before COVID. There was a waiting list, but it wasn't like 4 years. But something happened when people were in lockdown that I think there was a lot more social like awareness on social media, but also people were really struggling to focus at home, like either like because they were at school or because they were working, and that's when this kind of massive like waiting list, and it's not fair really to the people who are really suffering and waiting for it and can't afford to go privately. In the US, I mean, I'm guessing if you've got health insurance that you have good access to a psychiatrist to regularly review not just your medication, but your general mind health. But
Yeah,
Yeah, I was going to say, like, from a general practice and public health perspective, it's quite an interesting scenario from, like, if you're in a GP practice. So, um, a lot of people in the UK can actually I mean, so usually what happens with shared care arrangements, um, what happens is the GP makes a referral, they get seen by a psychiatrist, and they come to a arrangement in terms of plans. However, what can happen is that sometimes there can be delays in your GP practice receiving or reading information about the shared care arrangement. And what can happen sometimes is that you can get prescription for like ADHD medicines, and there can be a bit of a delay in getting it prescribed, which can take a lot of time. But also, like from GP practice perspective, if you are taking methylphenidate or in Elvance, it's worth just getting your weight checked every 6 months, and also like having medication reviews every year as well. Because like during a medication review, they'll also want to check for your blood pressure, your heart rate, to see if there's any changes. Because as I'll touch on in a bit, um, sometimes it can increase your heart rate and your blood pressure. Tiny change is okay, but if it goes above a certain threshold, then you would need to speak to a psychiatrist to get your medication adjusted, usually to a lower dose, or potentially change the medication as well.
The only other thing before I hand out to you, I realized there were questions about hormones and ADHD symptoms. And I just wanted just very quickly just to talk about this. Annoyingly, but it's about estrogen essentially. So it's not gonna, ADHD medication doesn't change your hormone levels. It's because estrogen supports dopamine and noradrenaline. And estrogen varies in your cycles. So when estrogen rises mid-cycle, many women naturally feel like mentally clearer, calmer, more focused. But when it drops before your period, the symptoms intensify. And therefore, you become more irritable, overwhelmed, you struggle with motivation, organization. So the medication is not disrupting your hormones, but your sensitivity to the medication can shift with these hormonal patterns. And then there's a big thing in the UK, certainly, and I'm seeing on social media, is about perimenopause. Because remember that in perimenopause, again, your estrogen is changing, and therefore women who are like it's sort of becoming unmasked, in that they've probably got children, busy jobs, and like undiagnosed ADHD, and suddenly the estrogen drops, and it's like feels like very, very challenging times. So like it's about sort of understanding your natural rhythm, and like the sort of self-compassion about your expectations, which has always been hard for women.
Yeah.
That's it. I'm going to stop sharing.
Yeah. With someone with it, we've got quite a few addicts on the call here. And if someone does have addiction issues, and they've had issues with Adderall or some sort of methylphenidate, Ritalin, what would the alternative? Will Butrin be an option?
If they've been addicted to the actual medication.
Yeah, or they've had addiction issues. What is the non-addictive? What is the best ADHD meds for someone who's had addiction issues with any sort of a stimulant, you think?
I mean, like the other thing that this professor I trained under would say is that like if you want to get addicted to a drug, like it's very like the ADHD medication is such a small amount that it's not a drug of abuse. I mean, that's the fear, right? That you would get addicted to that, but it doesn't give you that euphoria and that high. So, in general, actually, what the research has shown is that when you're on the medication, you're much less likely to use. There are people actually who do have addiction problems who are really worried about stimulants, but I've never seen people becoming addicted because there's no euphoria like that you would get with like a hit of sort of MDMA or like a lot of cocaine. But I don't know whether Tanzil agrees with that.
Yeah, I mean, it's quite tricky. Like, truth be told, most of the ADHD patients I've encountered in general practice or retail pharmacy, I wouldn't really say I've seen any of them become addicted to methylphenidate or Elvance. It's not something I've actually noticed before, if I'm completely honest. I mean, some people do feel I say in children, it's more of a parents feel that they need it in order to help control their children's ADHD. But in terms of adults, I can't really say I've seen addictive behavior with it, if I'm honest.
And I just saw someone saying that I don't think it's something, it is a control drug because if you took loads of medication, and also it has street value, people, would just take a whole load of that and create something from it. But it's not actually a controlled drug because of these small amounts because of the likelihood that it would cause addiction for you, if that makes sense. It's interesting that this person said Concerta definitely gave me euphoria, so I switched to Elvance. I wonder whether it was a too high a dose of Concerta because it shouldn't really be giving euphoria. I've not seen that in anyone because it shouldn't be at that dose. But I actually agree that Elvance has a much smoother. What's frustrating is that in the NHS, where I have a community mental health team, I can't prescribe the ADHD medication because we have an ADHD service which is commissioned within our trust, and this is and it's because of it's a controlled drug. I actually think it's about morality and that like it's very sort of historic beliefs about drugs and because quetiapine, which is a drug I prescribe for people who've got like psychosis or depression, that's like one of the risks of like sudden death. It feels like I feel like ADHD medication, I think it's a lot of fear, but rather than reality.
Yeah, I think the
Yeah.
situation in the US might be different because of their
Hmm.
prescribing habits. I know that, prescription stimulant misuse is a recognized problem in the US. There was a meta-analysis done of substantial past year misuse in some populations with a prevalence estimated around 15 to 25% in mixed samples. And a diversion also reported risks are higher in adolescents and young adults. So in the US, it is like an epidemic. Adderall is an absolute epidemic with usually wealthier kids in college and then going off to work in Wall Street. It is just like they're all it's an absolute epidemic. And that
Like,
would
I'm
like
sorry.
like a
Nick, I
pill
just
they've
wanted
got
to
pill mills.
give you a heads up on time. So we've been going for a little over 45 minutes. Um, I see a lot of questions in chat. I mean, will you guys have time to stick around over the past an hour? Okay. All
We
right.
should be
So,
able to.
yeah, I don't know if you want to go to questions now or you want to present a little more. It's up to you guys.
If possible, is it okay if I talk about side effects, red flags
Yes.
as
Yeah,
well?
that
Yes.
would be great.
Also as well about like useful sources of information, and actually kind of touching on Nick's point in terms of what's happening stateside. So I've got a few friends who work in California, and they've got kids in California, and also some relatives in New York. I think the Adderall addiction amongst teenagers is kind of like due to essentially they're mainly taking it so that way they can concentrate on schoolwork, get into good universities, and essentially try and score high marks or perform well in very mentally taxing tasks. But because of that, they kind of feel that that's the only way they can deal with it without looking at any other options like cognitive behavioral therapy and like other like lifestyle interventions, really. But yeah, going on to side effects. So side effects with drugs can usually be classified as five categories. Very common side effects, so it affects around 1 in 10 people, maybe a bit more. Common side effects, so it affects between 1 in 10 to 1 in 100 people. Uncommon side effects, which is between 1 in 100 and 1 in 1,000 people. Rare side effects, which is 1 in 1,000 to 1 in 10,000 people. And very rare side effects, which is less than 1 in 10,000 people. So with both methylphenidate and lisdexamfetamine and dexamphetamine, people can often notice changes in their weight as well as their sleeping cycle So sometimes people can experience less sleep. So usually, from what I've seen, is say for example, if you're taking the methylphenidate once a day or Elvance once a day, they usually recommend to take it in the morning, so that way it can help with sleeping. But in terms of things to look out for, these are things known as red flag symptoms. So this tends to be things that you tend to see happen very rarely or rarely. And often, if you do find you're experiencing a symptom which you're quite concerned with, it's worth just speaking to a GP about it or your physician, or even if you're possibly able to, your psychiatrist. So things to look out for would be red flag symptoms which could affect your heart and your lungs. So if you notice like you're getting like really fast heart rate, your chest is hurting, you experience some swelling, or if you develop like very unusual rashes, if you notice that you're losing a lot of weight unexpectedly, speak to your doctor immediately. Or if you're in the UK, you can call somebody, I'm in a service called 111, because this is the NHS's, so the UK's main public health, I mean, UK's main health providers out of hours service, which is available 24 hours, 7 days a week. But like I said, a lot of red flag symptoms um, they tend to be rare or very rare. Sometimes some people can experience stuff like diarrhea, nausea, constipation, but your body can adapt to this over time. However, if it is something you're not comfortable with, just make sure that you speak to your GP or to prescriber about it. Um, you can experience some changes in blood pressure and heart rate, so it can go slightly up. Again, this would be something that you'd have to get monitored by your GP and also mention to your psychiatrist. And also, Joe touched upon this, like in terms of driving, if you do feel that your driving or your ability to drive is getting affected by the medicine, just let DVLA know, but also just speak to your psychiatrist, um, as they may be able to give advice about how to adjust your dosing schedule in order to make sure that you don't feel drowsy when you're taking the medicines. And trying to think what other symptoms. Also, like if you feel like you're going to harm somebody, or if you feel that you're going to get harm to yourself, just make sure you speak to 111 or potentially see A&E. And also just make sure you let your psychiatrist know if you develop any like anxiety or really bad depressive symptoms, or you have like major changes in your mood. Yeah, I think that's pretty much it in terms of symptoms.
All right. Well, thanks. Any questions, you guys?
Oh, yes, lots of questions in
Got a
chat.
load of questions. Yeah, a
So
lot of
I'm
them.
gonna, do we have anybody of our co-host team can time the questions? Because usually we give it a minute because it's a question rather than a whole share.
One of the things that I think is good to talk about, if we can, very briefly, is about supplements, because there wasn't space to talk about that. But it's
Yeah.
interesting someone's asked, and and it'd be interesting to hear from Tanzil and from Nick what they think. I suppose one of the big things, again, like an academic professor told me, is that if you see anyone, tell them to take omega-3. And so that really stayed with me. She said that about like 15 years ago to me. And I take it, my kids take it, my husband takes it. So I actually take omega-3 and 6. And there's evidence certainly for omega-3, a systematic review found small but significant reduction in ADHD symptoms. I do take it. I take high dose 3 and 6. I just think there's no negative side effects from something like that. I also I don't take Ginkgo, someone's mentioned it. I tried lion's mane. I didn't notice a difference. Be curious to hear from other people whether they've noticed any. I don't think there's any evidence base for lion's mane. Ashwagandha, I do find a difference with that. So, but it was, yeah, I'm not taking huge doses. I'm just taking like a standard one. And I actually take it on days when I haven't taken Elvance, the lisdexamfetamine. If someone says saffron, I mean, I'm actually Iranian, and we use a lot of saffron and turmeric. And I don't know if there's any evidence, but it's definitely delicious. I'll look it up, but I don't know if what you're looking for if you want to take something is look at a meta-analysis. That's the highest form of evidence. It's when they put together all the studies. And so omega-3 definitely has that. It's small but noticeable. And I know that ashwagandha and lion's mane doesn't have that. But
Yeah, diet's often forgotten in this whole thing. And I've taken the omega-3s, and I find even the sardines in the end, like the small fish, have tons of that, and they're way better than the pills.
Also,
Personally,
dark chocolate as well is very underrated, like 70% dark chocolate and above.
yeah, but the for the omega-3s, the small fish are incredible, and I think they're better than the pills. Like, I mean, you're eating a real food, and I feel so much better when I eat these sort of sardines, anchovy, these sort of smaller fish. I think I noticed the difference. And diet's forgotten. We go immediately to pills before exercise, diet. I mean, all these, you know, practical things that our ancestors would have used. We go straight to the meds when I think we need to talk about a lot of the time, exercise, diet, and I mean, these are the things we discuss in our groups. These, I
So
think, right,
in the
but
UK, in the last few years, so since COVID, there's been increase in something called social prescribing. So social prescribing is something which I definitely recommend people speaking to their GPs and potentially psychiatrists about. So what it is, like usually if you're in a general practice and you feel like you need some advice about your nutrition or about exercise or like overcoming addiction to recreational drugs, to smoking, to alcohol, your GP can actually refer you to a community team, or to a social prescriber who's like a specialist who can help you with these things. Also, dietitians and nutritionists, be it funded through the NHS or privately, are really good when it comes to advice about nutrition. Because, like Nick and Gia said, like diet can play a massive impact in terms of your mental health as well as your physical health. And often, I would say dietitians and nutritionists are really good at finding out what minerals you need, what vitamins you need, and even protein as well. Protein can play a key part as well.
mm,
And kind of touching to Gia's questions regarding supplements. Generally speaking, I would say if you're in America, look at the FDA list of supplement. I mean, FDA has got a list of supplements which can be useful from a medical sense. UK is a bit behind in that regards, but they're ahead in others. My advice is if you are looking at supplements, speak to your pharmacist if you're in the UK because they'll be able to advise on what the active ingredients and what the non-active ingredients are with the supplements you want to take. And they'll be able to tell you whether or not it will interact with your medication. So omega-3, it's pretty harmless in terms of interactions. But say, for example, not ashwagandha is okay as well. However, say if you went to a unlicensed medical place like a Chinese herbal shop, for example, and they're giving you a very weird mixture of like different herbal products, I would be very careful about it because you don't know how many different ingredients are inside of it, is what I would say.
mm,
And also kind of touching on saffron. It's quite an interesting one. So I myself am of mixed heritage, like Indo-Iranian, Af East African, and it's interestingly enough, saffron like is very closely related to a drug called colchicine, which is used for people with gout. So I'd be personally quite interested to know what impact it has on mood. But also for me personally, I want to see what impact it has on like, like joint problems as well. But turmeric is pretty good for like inflammatory conditions as well. And I would probably recommend actually getting either the powder or the root if you can, rather than the tablets, because you can actually control it a lot better.
yeah,
mm,
there's some more stuff. I mean, I've been seeing this stuff, people taking magic mushrooms, psilocybin for ADHD, and using marijuana as well. I just I
mm.
don't
For me, I
done
would be
those. I
against it,
just
but I'm
don't
curious to know
see
Gia's
that.
perspective.
Yeah, I've done
I mean,
those.
I think there are other things I would try first. And the big thing
I
actually we
agree.
haven't said is ferritin. So getting your iron levels checked because iron is actually essential for dopamine. So iron, I mean, the things, vitamin D, magnesium, definitely iron if your iron levels are low. Someone said I don't know, theanine, L-theanine. I actually bought that, but I
That's
didn't take it
B1, isn't it?
consistently. Yeah, exactly. It's got a moderate evidence base actually for like improved sleep, reduces anxiety, calms hyperarousal. I don't think I took it enough, but there's no evidence for ginseng. But if it works for you, like remember that because supplements, there's no money in researching supplements because the big pharmaceutical companies, they've got an agenda, right? They want to show that their drug works. Whereas who's going to put the money behind like Ginkgo? There's no money there to be made. So
Yeah.
no one's going to do the research.
I mean, if you have like independent people doing it, that'd be great. But problem is like independent people, they need funding, and sadly, a lot of their funding tends to come from drug companies, so it can be quite tricky.
Yeah.
Mm.
The problem is with the supplements, there's just so many fake companies out there. You don't even know what you're getting. So there
Yeah.
is that massive issue.
Just like Nessie has written about that she was on private and in the NH, so she did it, and the GP won't accept it. Like, although Nessie, she said what she should do. Someone else said that the GP won't accept the private diagnosis. I would actually move to a different GP. I don't know whether Tanzil agrees, but like what I found in general, like the only place I haven't had it accepted is in Scotland, because they are very clear. There are some areas in like Sussex I've heard of that don't, like they've got some special thing where they don't accept shared care, but it's actually worth moving GPs. Because
So that's actually a bit of an interesting thing, and I think it comes down to what part of the country you're in if you're talking about the UK. So in the area which I live in and work in mainly, which is home counties region, so Hertfordshire, Bedfordshire, Buckinghamshire, Northamptonshire, they are got a weird policy when it comes to shared care agreements in the sense that they'll accept it from some private care companies, but other private care they're a bit apprehensive about due to essentially questionable prescribing practices, which is a bit unusual because in theory shared care agreements should be accepted by everyone, but each place has got their own policy. However, when it actually comes to obtaining medicines, this is actually something I wanted to talk about a bit earlier, but we're a bit pressed for time. So in the UK, when you're looking at prescriptions for ADHD medicines, legally you have to, once a doctor prescribes it, you have to get it dispensed by a pharmacy within 28 days. Otherwise, you won't be able to get it. And in terms of purchasing it online, I would actually look at something called the General Pharmaceutical Council's website because in terms of online pharmacies, a lot of the ones you see online in the UK, they're actually not real. So the GPHC or General Pharmaceutical Council is it's the main governing body for pharmacists and pharmacies in the UK. So if an online pharmacy is registered with them, then they would be the only place you should be getting it from if you're ordering it online. Otherwise, make sure you hand in your prescription to a pharmacy in order for them to essentially give you your medication. And in the past, so pre-Brexit, there used to be something called FMD, so Fortified Medicines Directive. So what would happen is pharmacies would be able to scan the barcodes for different medicines, like say for example Elvance or Concerta, and you'd be able to tell straight away if it's fake or real. Problem is, since FMD is no longer a thing, um, what you do find is a lot of pharmacies are either selling fake medicines or they're selling very expired medicines where there's no clear evidence of whether or not it's been obtained legally or not. So you do have to be a bit careful when it comes to obtaining
Yeah.
ADHD medicines.
So quick question. I think someone's asked Vera, because anxiety and depression are such um, big comorbidities with ADHD, taking Prozac, what would the impact be with ADHD drugs, because a lot of people are on antidepressants as well. And I'm just wondering, I think it's a good question because anxiety, depression are such massive components to ADHD.
There's like a small theoretical risk of something called serotonin syndrome, but it's only theoretical. Like I've never seen it before. So you just have to be aware that the stimulant medication can indirectly affect serotonin levels. So we just tell people what to like, and I can like put it in the chat, like what to watch out for. But you would know if you were like, you basically get like a temperature, you feel very unwell, you would stop the medication, go to hospital. But it's actually very common for someone to be on Prozac or fluoxetine and or sertraline, like either of them and a stimulant. And I think it's a theoretical risk, really, rather than I've
And
never
the worst drugs, street drugs to use with ADHD meds would be what? Like another stimulant, like cocaine? You
Yeah.
think doubling up? I mean, I know a lot of people when they're on the meds and they have a coffee, it just like they go right off the Richter scale.
Yeah. I actually tell people not to drink coffee on the days they're taking medication. I
Would
just
you
don't
also
think
apply that to tea
good
and
idea.
energy drinks as well?
Yeah. Any energy drinks, any sort of Diet Coke. I think you don't want to take a stimulant with a stimulant. Like, be sensible. Your heart rate's going to go up, your blood pressure.
Also, like cold and flu tablets as well, you have to be really careful
Yeah.
with because, like, say for example, like if it's paracetamol, to be honest, is pretty okay to take, as long as you follow the manufacturer's instructions. But if it's like, say, paracetamol and they add like caffeine to it, or they add like pseudoephedrine or ephedrine, so like Sudafed or like day nurse, night nurse, then you're increasing the risk of side effects with like Elvance, for example, or methylphenidate, because you're adding one stimulant to another, essentially.
Thank you. Yes, I've been I've been misdiagnosed, got the wrong stuff, abused stuff. I mean, I've been through the ringer. That's why I'm so happy to be able to bring people information like this. So thank you.
Thank you for having us,
Thank you,
Pat.
Gia.
Greatly
Thank you,
Thank you for having us,
Tanzil. Thank you,
guys.
Nick.
If
Just to
if we
let you
can get
know,
the
we're
link, a lot of people
yeah,
have asked for the link, so if you don't mind
yeah,
sharing.
yeah. I'll make
And I can
sure
share my
people.
slides as well, if anyone's
That'd be
interested.
great. Yeah, if you send us everything and we'll get it out there, whatever information you want us to get out, I'm happy to do it. We have a large community. And also tomorrow we have our emotional sobriety meeting, same time, same Zoom as this one. Saturday we have our internal family systems book study. Sunday we have our AA beginners meeting, Q&A for AA beginners. Monday we have our Somatic Monday with Donna Martin. Donna has been teaching Hakomi and Soma yoga. She developed her own type of yoga. She's one of the founders of the International Yoga Therapists Association. She's been in practice over 50 years. She's now retired, but she teaches. So she's coming to do a talk with us on Monday. And she's one of the legacy holders for the founder of Hakomi therapy. Hakomi is a mindfulness-based yoga therapy. Anyway, it's really interesting stuff. And so she's written various books on that, and Donna will be with us on Monday. So we do a lot of, a lot of educational stuff. And I'm so happy that you guys, thank you so much for your generosity with your time. You stayed overboard. This is supposed to be an hour. It's been an hour and a half. And I really appreciate that you're doing this work. It's so I can't tell you, this is really important work, especially in our community, the addiction field. So many of us get misdiagnosed and messed around with the healthcare system. It's such a confusing situation. So I'm glad that you were able to shed some light on it for us. I really appreciate it. Nick, do you want to tell us about what you're doing with your meetings? Because people are asking how to. I know you're
Yeah, I mean,
live in London.
you can go to our website, www.ADHD Action Network. I can put that in there, and you can just, I mean, right now we've got a group. You could just add yourself there, and we will be having we're running this cohort till the end of the year, and then we'll be starting some new groups in the new year. And then inevitably we hope to bring it online, but we're just doing things in person to get the programming all right. And yeah, I just, we're interested. We're here helping people, working with the NHS and the council. And yeah, we're just, keep in touch.
All the
That's all I
best.
can say. We're
All
going to
the
do
best.
more of this kind of stuff and try to find great people like Gia and Tanzil, and work with great people like that, and keep the wheels turning to help folks out in the community. Thank you
Well,
for
you
having
can
me.
come back here anytime.